Have you ever found yourself wide awake at 3 a.m., staring at the ceiling, wondering why you just can't fall back asleep? Maybe you've tried everything, counting sheep, adjusting your pillow, but the clock keeps ticking and sleep feels like a distant dream. If you're over 60, you're not alone. The 3 a.m. wake-up is more common than you might think, and it's not just about not getting enough rest. There could be health issues behind it that, if addressed early, can be managed or treated. I know how frustrating this is. You're tired, but your mind just won't cooperate. It's exhausting, and worse, it can leave you questioning your health. Is this normal, or is something else going on? Don't worry. You don't have to accept sleepless nights as part of aging. There are steps you can take to improve your sleep and feel more energized. In this video, we'll uncover 5 reasons why older adults wake up at 3 a.m. and what you can do about it. Let's dive in and get to the bottom of this mystery together. Hormonal changes, especially low melatonin levels. What happens? As we age, our bodies undergo several changes, and one of the most impactful is a decrease in melatonin production. Melatonin is the hormone that regulates our sleep-wake cycle, signaling to our body that it's time to rest. Unfortunately, as we get older, our bodies tend to produce less melatonin, which can make it harder to stay asleep throughout the night. This hormonal shift can leave many older adults waking up at odd hours, especially around 3 a.m. Real story. Mrs. Dawson, 72, started experiencing restless nights, often finding herself wide awake at 3 a.m. At first, she thought it was just a part of aging. But after discussing her sleep struggles with her doctor, she learned that her melatonin levels had dropped significantly. This explained why she couldn't stay asleep, no matter how tired she felt before going to bed. Solution. One solution that can help restore a better sleep pattern is melatonin supplementation. However, it's important to consult with your doctor before adding any new supplements to your routine. The right dosage can vary from person to person, and your doctor can help determine what's safe and effective for you. In addition to supplements, creating a healthy sleep routine can work wonders. This includes dimming the lights about an hour before bed, which signals to your body that it's time to wind down. Avoiding bright screens, like your phone or computer, is also crucial because the blue light emitted can interfere with your body's production of melatonin. Another tip is to try and go to bed at the same time every night. Consistency can help your body adjust and create a natural sleep rhythm. If you wake up in the middle of the night, don't look at the clock. This can increase anxiety about not being able to sleep. Instead, relax and focus on breathing deeply to help you drift back off. By paying attention to your body's needs and making small adjustments, you can significantly improve your ability to sleep through the night and feel more rested during the day. If the 3 a.m. wake-ups persist, always talk to your healthcare provider. They can help assess if there's a deeper issue at play and guide you toward the best solutions tailored to your unique needs. Frequent urination, nocturia. What happens? As we age, our bodies undergo a variety of changes, and one common issue that many older adults face is frequent urination at night, also known as nocturia. Our kidneys, which regulate the body's fluid balance, begin to function differently as we age. This can lead to more frequent trips to the bathroom during the night, disrupting sleep and making it harder to fall back asleep once you've woken up. This issue isn't just inconvenient. It can take a serious toll on your overall quality of life. Not only can it leave you feeling tired and groggy the next day, but it can also increase the risk of falls, especially if you're rushing to the bathroom in the middle of the night in a groggy state. For many seniors, waking up to use the bathroom becomes a nightly occurrence, often multiple times, and it can be difficult to get the deep, restorative sleep that you need. Real story. Mr. Thompson, 78, began experiencing frequent nighttime awakenings to use the bathroom. It became so regular that he found himself waking up at 3 a.m. almost every night, only to struggle to fall back asleep afterward. He realized that the broken sleep cycle was taking a toll on his energy levels during the day. Initially, he thought it was just a normal part of aging, but after discussing it with his doctor, he learned that it was a common condition among seniors. Mr. Thompson's situation wasn't unique, and many older adults experience similar challenges. Solution. One of the most effective ways to address nocturia is to adjust your fluid intake before bedtime. Limit your consumption of fluids, especially caffeine and alcohol, during the evening hours. Both caffeine and alcohol act as diuretics, which can increase urination and disrupt sleep. Aim to finish drinking most of your fluids a few hours before bed to give your body enough time to process and eliminate them. Another helpful strategy is elevating your legs during the day. As we age, fluid tends to accumulate in our lower extremities, and this can cause more frequent nighttime urination. By raising your legs throughout the day, whether by propping them up while sitting or lying down, you can encourage the body to process this excess fluid before it gets to your bladder. This simple step can reduce fluid buildup, allowing you to stay dry and comfortable through the night. In addition, practicing good sleep hygiene can also help. Going to bed and waking up at the same time every day, avoiding large meals before bed, and keeping your bedroom cool and dark can promote better, uninterrupted sleep. If nocturia persists and continues to disrupt your life, don't hesitate to talk to your healthcare provider. They can help identify the root cause of your nighttime trips to the bathroom and may suggest additional treatments, such as medications or other therapies, to help reduce the frequency of nighttime urination. By making small adjustments to your routine, you can minimize the effects of nocturia and regain a sense of control over your sleep, allowing you to wake up feeling refreshed and energized. Sleep apnea. What happens? Sleep apnea is a condition that affects many older adults, where the airway becomes temporarily blocked during sleep, causing breathing to stop for a few seconds to a minute. These interruptions can occur multiple times throughout the night, leading to fragmented sleep and poor sleep quality. One of the most common signs of sleep apnea is waking up suddenly in the middle of the night, gasping for air or feeling short of breath, especially in the early morning hours. The lack of oxygen can cause your brain to briefly wake you up to restart normal breathing patterns, leaving you feeling exhausted the next day. What's concerning about sleep apnea is that it often goes undiagnosed, as many people don't realize they're experiencing interrupted breathing while they sleep. The condition can lead to a range of health issues over time, including increased risk of high blood pressure, heart disease, and stroke, as well as reduced cognitive function and overall energy levels. If left untreated, sleep apnea can significantly affect your quality of life, leaving you constantly fatigued, irritable, and unable to fully enjoy daily activities. Real story. John, 80, had been waking up every morning feeling completely exhausted. No matter how long he slept, he never felt rested. His wife, noticing that he frequently stopped breathing during the night, encouraged him to seek help. After undergoing a sleep study, John was diagnosed with sleep apnea. He was shocked to learn that his constant exhaustion was due to interrupted sleep caused by his airway being blocked during the night. With treatment, including the use of a CPAP machine, John was able to improve his sleep quality and finally wake up feeling refreshed and energetic. Solution. If you suspect you might have sleep apnea, it's important to talk to your doctor. They may recommend a sleep study to monitor your breathing patterns while you sleep, which will help diagnose the condition. A common treatment for sleep apnea is the use of a CPAP, continuous positive airway pressure, machine, which keeps the airway open by providing a steady stream of air through a mask worn over the nose or mouth during sleep. This helps prevent the airway from becoming blocked and reduces the frequency of breathing interruptions. In addition to CPAP therapy, certain lifestyle changes can help reduce the severity of sleep apnea. Losing weight, for instance, can decrease the amount of fatty tissue around the neck that may be contributing to airway obstruction. Avoiding alcohol and sedatives before bed can also help, as these substances relax the muscles in the throat and increase the likelihood of airway collapse. Sleeping on your side, rather than on your back, can also reduce sleep apnea symptoms by preventing the tongue from blocking the airway. If sleep apnea is left untreated, it can lead to long-term health complications, so it's crucial to seek professional help if you think you might have it. With the right treatment and lifestyle adjustments, you can greatly improve your sleep quality and overall well-being. Don't let sleep apnea rob you of your rest. Take action and get the help you need to enjoy deeper, more restful sleep. Anxiety and stress. What happens? As we age, life often brings an array of new concerns. Our health, the future, our financial security, and the well-being of loved ones. While these worries are a normal part of life, they can begin to take a toll on our sleep. The weight of these anxieties can make it difficult to fall asleep in the first place, but more often than not, they can also lead to waking up in the middle of the night, sometimes around 3 a.m., unable to quiet our racing thoughts. The sense of unease or fear can feel overwhelming, especially when we're exhausted but can't seem to drift back off. When we are under stress or feeling anxious, our bodies remain on high alert. This is because of the way our nervous system responds to stress. Cortisol, the body's primary stress hormone, is released, making us feel more awake and alert, even when it's time to sleep. This heightened state of alertness can make it harder to relax enough to fall into a deep sleep, and when we do wake up in the middle of the night, the thoughts that keep us awake can feel relentless. Anxiety can also affect our overall sleep quality, as it leads to shorter, fragmented periods of rest. Over time, chronic anxiety and stress can contribute to insomnia, creating a vicious cycle where poor sleep worsens stress, and stress in turn worsens sleep. Real story. Linda, 69, began experiencing frequent 3 a.m. wake-ups after months of anxiety about her health. She was dealing with a chronic condition that caused her physical discomfort, and with each passing day, the worry about her health seemed to mount. Linda found herself tossing and turning in the middle of the night, her mind racing with thoughts about her future. No matter how tired she was, she couldn't seem to quiet the anxiety. Even though her body was exhausted, the worry kept her up, leaving her drained during the day and unable to enjoy the activities she once loved. The frustration of not being able to sleep was starting to affect her overall well-being. Linda's doctor suggested she try different mindfulness techniques to help calm her mind before bed. Although skeptical at first, she decided to give it a try. After a few nights of practicing deep breathing exercises, she began to notice a difference. While it didn't immediately fix all her anxiety, Linda found that she was able to relax her body and mind just enough to drift off to sleep. Over time, she added meditation to her routine, and it further helped to ease her mind and break the cycle of waking up at 3 a.m. While her concerns about her health still lingered, Linda found peace in knowing she could manage her anxiety with these tools. Solution. If you're experiencing anxiety that's affecting your sleep, it's important to address it before it becomes a chronic issue. Here are a few solutions that might help you reclaim your rest and restore your peace of mind. Practice mindfulness techniques before bed. Mindfulness is a powerful tool for managing stress and anxiety. Deep breathing exercises, guided meditation, or even simple relaxation techniques can help activate the body's natural relaxation response, lowering your heart rate and calming your mind. One simple technique is the 4-7-8 breathing method. Inhale for 4 seconds, hold your breath for 7 seconds, and exhale slowly for 8 seconds. This can help signal to your body that it's time to wind down for sleep. Establish a calming bedtime routine. Create a routine that signals to your body it's time for rest. This can include activities like reading a book, taking a warm bath, or listening to calming music. Avoid stimulating activities or watching distressing news right before bed. The goal is to transition into a state of relaxation, making it easier to fall asleep and stay asleep. Talk to a therapist. If your anxiety is persistent and affecting your sleep regularly, consider talking to a therapist. Cognitive behavioral therapy, CBT, is a highly effective treatment for both anxiety and insomnia. CBT for insomnia, CBTI, can help you break the cycle of worrying and improve your sleep patterns by teaching you how to manage negative thoughts and behaviors related to sleep. Consider natural supplements. In some cases, natural supplements like chamomile tea, valerian root, or magnesium can help promote relaxation and improve sleep. However, it's important to consult with your doctor before introducing any new supplements to ensure they won't interfere with medications you may already be taking. Exercise regularly. Regular physical activity can help reduce overall anxiety and stress. However, try to avoid exercising too close to bedtime, as it can leave you feeling too energized to sleep. Aim for moderate exercise during the day to help regulate your body's sleep-wake cycle. Limit caffeine and alcohol. Caffeine is a known stimulant that can interfere with your sleep, especially if consumed later in the day. Similarly, while alcohol may initially make you feel relaxed, it can disrupt your sleep later in the night. Try to avoid these substances, especially in the hours leading up to bedtime. The key to breaking the cycle of anxiety-induced wakefulness is consistency. It's not always easy to manage stress, especially as we get older and life's concerns seem to mount. However, with the right tools and support, you can improve your sleep and begin to feel more rested and rejuvenated. Don't let anxiety steal your rest. Take small, manageable steps to find the peace of mind you need to sleep soundly through the night. Medications and health conditions. What happens? As we age, many of us find ourselves managing a variety of medications and health conditions. Some of these can interfere with our sleep in unexpected ways. Medications like diuretics, which are used to treat high blood pressure or fluid retention, can lead to frequent nighttime trips to the bathroom. Similarly, antidepressants and other prescription drugs can disrupt the natural sleep cycle, causing restlessness or waking up during the night. Additionally, chronic health conditions such as arthritis, restless leg syndrome, or even diabetes can contribute to nighttime discomfort, making it difficult to fall asleep or stay asleep. For many older adults, sleep disruptions are linked to the side effects of medications. These side effects can include everything from increased bathroom trips to heightened anxiety or physical discomfort. Conditions like arthritis can cause joint pain that flares up at night, making it impossible to find a comfortable sleeping position. Restless leg syndrome can lead to an uncontrollable urge to move the legs, especially when lying down, making it difficult to relax and sleep. Real story. Sarah, 75, had been living with arthritis for years, but it wasn't until recently that the condition began seriously affecting her sleep. Every night, no matter how tired she was, Sarah found herself wide awake at 3 a.m. The pain in her knees and hips made it impossible to find a comfortable position, and no matter how she shifted or propped herself up with pillows, the discomfort kept her from falling back asleep. The frustration was overwhelming. She was exhausted, but the pain wouldn't let her rest. Sarah had tried over-the-counter pain medications, but they didn't seem to help much. She had also started taking a low-dose antidepressant to help with mood, but she didn't realize that this medication could also contribute to her sleep disruptions. After speaking with her doctor, Sarah learned that some of her medications could be interfering with her sleep. The combination of arthritis pain and the side effects of her prescriptions were creating a perfect storm of sleep problems. Sarah's doctor recommended reviewing her medication regimen and considering some adjustments. They also talked about non-medication treatments to help alleviate her pain. For her arthritis, Sarah was encouraged to try heat therapy before bed, such as using a warm heating pad on her joints. Stretching exercises and gentle yoga before bed were also suggested to help relieve tension in her muscles and joints. Additionally, her doctor advised adjusting the timing of her medications to see if that made a difference in her sleep quality. Solution: if you find yourself waking up at 3 a.m. due to discomfort or medication-related side effects, there are several steps you can take to improve your sleep. Here are a few suggestions that might help. Review your medications. It's important to regularly review your medications with your doctor. Certain medications, especially diuretics, blood pressure medications, and antidepressants, can affect your sleep patterns. If you're experiencing sleep disruptions, talk to your doctor about the possibility of adjusting your prescriptions or the timing of your medications. In some cases, switching to a different medication or adjusting the dose may be all it takes to improve your sleep. Manage chronic pain. Chronic conditions like arthritis, back pain, or fibromyalgia can create significant discomfort at night, making it hard to sleep. If pain is keeping you awake, consider using non-pharmaceutical methods to manage it. Heat therapy, such as a warm heating pad or a hot bath before bed, can help soothe aching joints and muscles. You might also want to try stretching or gentle yoga exercises in the evening to relax your body and reduce tension. Consider a pain management plan. If your pain is severe and consistently disrupting your sleep, it may be time to work with your doctor on a comprehensive pain management plan. This could include physical therapy, topical treatments, or even injections, depending on your specific condition. In some cases, prescription pain relievers may be necessary, but they should be used cautiously and under your doctor's supervision to avoid side effects. Improve your sleep environment. Sometimes, sleep disruptions are caused not just by pain or medication, but by the sleep environment itself. Ensure that your bedroom is comfortable, quiet, and conducive to sleep. Consider using a memory foam mattress or a pillow that supports your neck and back, especially if arthritis or other joint pain is an issue. Darkness and quiet are key factors in promoting sleep, so consider blackout curtains or a white noise machine if you live in a noisy area. Focus on sleep hygiene. Practicing good sleep hygiene can make a significant difference in your ability to fall asleep and stay asleep. Keep a consistent bedtime routine. Avoid caffeine or alcohol in the evening, and create a relaxing environment in the hour leading up to sleep. Reading a book, listening to calming music, or practicing mindfulness techniques can help signal to your body that it's time to unwind. Consult a specialist. If your sleep problems are persistent and affecting your quality of life, it may be helpful to consult with a sleep specialist. They can perform tests to determine if you have underlying sleep disorders such as sleep apnea or restless leg syndrome, which can also contribute to nighttime awakenings. Treatment for these conditions can include lifestyle changes, medications, or devices like a CPAP machine for sleep apnea. Sleep is vital for our health, and as we age, getting quality rest becomes even more important. If pain or medications are keeping you awake at night, it's essential to take proactive steps to address the issue. By working with your doctor, adjusting your routine, and implementing strategies to manage discomfort, you can significantly improve your sleep and overall well-being. Remember, you don't have to accept sleepless nights as a part of aging. There are solutions available to help you get the restful sleep you need. Now that you know the possible reasons behind those 3 a.m. wake-ups, it's time to take action. Don't just accept restless nights. Make a plan. Speak with your doctor about possible treatments. Try adjusting your routine. And most importantly, prioritize your sleep. Has any of these reasons resonated with you? Or do you have any tips to share on how you've improved your sleep? Drop a comment below. I'd love to hear your experiences and any advice you may have for others struggling with this issue. And don't forget to like and subscribe to Senior Health Secrets for more tips on how to improve your health and quality of life as you age. Let's work together to make sure your sleep is peaceful and your mornings are full of energy.